shortly present the data of our survey from European Association of Dermato-Oncology that dealt with the access to innovative medicine for metastatic melanoma in Europe. And in this survey also many ESMO melanoma experts were also involved. And the rationale for this study came from the recent ESMO study on availability of anti-cancer medication that revealed that the greatest disparities in the access to anti-cancer medicines are found in those cancers in which the treatment outcomes are dependent on the access to innovative medicines, and one of these cancers is metastatic melanoma, but because of the restrictions of the survey period of the ESMO study, the newest and the first recommended treatments from 2015 were not addressed, so this was the goal of our study, and also the primary goal was to estimate the number of patients that do not have the access to these drugs. And we performed a web-based online survey in 35 oncology and dermato-oncology centers in Europe from 30 countries, and we focused on the period from the 1st of May of 2015 to the 1st of May 2016. And we collected data on the number of metastatic melanoma patients that were treated in this period, and also the registration and reimbursement of the different drugs in this period, and also the availability of clinical studies and compassionate use programs. And all these detailed data will be presented on Monday afternoon. But now I'm presenting the one of the most important graphs, and you can see here the green color stands for registered and reimbursed drugs. The light green is for registered, and dark green for these are reimbursed. And the red color is for that these drugs are not registered or not reimbursed. Also, you can see the dark red circles, and these are the first line recommended treatments per European guidelines, so the ESMO guidelines, which were published in 2015, and also EADO, EDF guidelines, EORTC guidelines, which are published this year, the updated version. So you see the first line treatment with BRAF and MEK inhibitors and also anti-PD-1 immunotherapy, which are recommended first-line treatments. In majority of Western countries, you see that these drugs are registered and reimbursed with some restrictions in reimbursement, which are here indicated by asterisks. And also you see that in Eastern and Southeastern Europe, the majority of these drugs are not registered nor reimbursed. And in all countries, in Eastern and Southeastern Europe, you see that there are restrictions, all kinds of restrictions to reimbursement, like some are only for the first line or only for the second line treatment, which are not scientifically based restrictions, or the drug is reimbursed but not available due to the hospital restricted budgets. So different types of restrictions are underway here. So, and finally, we estimated the number of patients of metastatic melanoma patients that are treated in Europe, and these numbers are, as you see here, 90,000. More than 90,000 patients are treated in Europe, and of those, nearly 40% are treated in Eastern and Southeastern Europe. That is more than 7,000 patients, and more than 5,000 patients, which is 70% of those, do not have the access to the first-line therapy that is recommended by the European guidelines, which stands for almost a third of all metastatic melanoma patients in Europe, that they do not have the access to innovative medicines. So this is the emerging problem for the patients, for their families, and also for the physicians, not only for the physicians from the Eastern, but also from the Western Europe, because many patients are referring and trying to gain the access, and it is not possible. So this is something that should be addressed by the oncology organization. Then ESMO is one of the main oncological organizations, together with the EADO, that can maybe initiate some solution to this problem, and I think that the next speaker will talk about it.